begin. So those of you that are joining us in the audience and those of you that are joining us digitally, we really appreciate you taking the time to engage with us on this very important topic, healthcare in Humboldt. We're going to explore the downstream impacts of Humboldt's healthcare challenges. But before we do, we want to thank our partners at Humboldt Area Foundation and specifically the Humboldt Health Foundation for providing us a grant which really funded this event. Couple housekeeping items really quickly. This place is on loan from Del Arte, and so we would ask that you keep it clean. This is a functioning school, and so they do have students in here. They do put on performances. So we ask that if there's any trash, you make sure that it finds its way into the trash can. If you are thirsty, there's water located at the top of the stairs under the Del Arte sign. Restrooms may be located on the first floor, so if you go out of the door on the ground floor and you hang a left, they will be on the right-hand side. If you go go out the exit that's at the top of the seating area, you go down the stairs, hang a left, and they are at the end. Lunch will be served today. It will be arriving between 11:45 and noon. You are welcome to eat at your seat. You're also welcome to explore the grounds. You're welcome to eat outside. There are picnic tables that are located outside, although I heard that it was like drizzling, so that may or may not be an option. If you do choose to eat outside, the only thing is that we ask is that you do not go onto the stage that's outside because they are prepping that for a performance. There's also some designated space to eat upstairs with tables in the student lounge. And so as we get closer to lunch, we will sort of show you where all of these rooms are. Also, I mentioned before that this is a functioning school. And so the folks at Del Arte have been kind enough to offer tours. If anyone is interested in taking a tour during the lunch break, just let us know and we can certainly arrange that. I can tell you there's a lot of interesting things happening at Del Arte. And if you have never taken the tour or this is your first visit to Del Arte, there is a lot to see here. So let us know if you're interested in that. And then finally, we have, actually, let me grab this. Our good friends at Del Arte will be awarding one lucky participant with 2 tickets to their opening night performance of Love is the Best Doctor. And so we will be, keeping with the healthcare theme, by the way, and so we will be awarding these to one lucky participant before lunch. I think I got it all. Awesome. Excuse me, Katherine. Okay, so we are going to go to the first Slido poll now. It is the intent of this event really to be more very interactive, and so we want to know what your experience is like. We want to know what your experience has been like interacting with the healthcare system in Humboldt. And so throughout today's event, there will be several opportunities for you to engage, ask questions of our panelists, and respond to some questions. So now we're going to take a second and we're going to ask you to respond to this. So, tough, worried, difficult, lacking, deteriorating. Challenging. So the bigger the word, the more responses. And so it looks like at this point, difficult is in the lead. Limited. Professionalism. Inaccessible. So based off of the results of this, it looks like difficult, limited, and inaccessible are probably the biggest things that folks think of that come to mind when thinking about the healthcare system in Humboldt. So we will revisit those results at some point during the event today. But I did just want to take a second and sort of inform the group that this is another part of a series that actually began with Supervisor Natalie Arroyo in January. She held an event, a panel discussion with local hospital executives and medical practitioners, primarily physicians, really just discussing the recruitment and retention challenges in Humboldt County relative to recruiting and retaining physicians, which play obviously a critical role in the healthcare process. Today's event seeks to build on that by examining the downstream impacts of that problem, and specifically some of the impacts to regional economic prosperity, some impacts to the workforce, because this is everyone's problem. If you can't recruit and retain physicians or qualified medical professionals, then what happens is that creates some downstream effects from an economic standpoint, because it's difficult to ask organizations to invest in an environment where their fundamental need is not going to be met for their employees. And so we'll discuss that today. Likewise, we're going to talk about the impacts to the community, and we're going to talk about the impacts to business. Did I forget that? Okay, so now it is time for us to tell you who we are. My name is Jeremy Clark. I am the Manager of Organization Development and Effectiveness for the County of Humboldt, housed in Human Resources, and I will pass it to Katherine.
Good morning. My name is Katherine Lourenzo, and I'm the Program Manager for the HRIS Data Management and Benefits Compliance Division in Human Resources.
Thank you. Good morning, everyone. And my name is Rosam Ruiz Cortes. I'm the Administrative Analyst for the Division of Organization Development and Effectiveness, also in Human Resources. And with that said, we're going to introduce our amazing panelists. Or rather, I'll ask them to introduce themselves. So if you could please state your name, what your organization is, a little bit about your role, and what lens you're bringing to today's discussion, please.
Hi, I'm Nancy Olson. I'm the CEO of the Greater Eureka Chamber of Commerce, as well as our 501c3 nonprofit affiliate, Redwood Coast Chamber Foundation. The lens that I'm bringing to this discussion is the impact on business when there is a lack of health care, and how that impacts their success as businesses, their employees, and that type of thing. So that's my lens. And part of it, you'll see, you will have seen on a previous slide, and maybe see it again. We conducted a survey in 2023 of all of our chamber members. We had about 125 responses from different businesses and nonprofits. And we asked them what their priorities were for our advocacy efforts. And first, they said, attracting and retaining businesses, which is appropriate. We're a chamber of commerce. But number two was healthcare. So businesses are very concerned about healthcare. They had 21 choices, and number two was healthcare. Number three was housing, not surprisingly. So I'll go ahead and pass it on.
Thank you, Nancy.
Good morning, everyone. My name is Zach O'Hannon. I'm the Director of Human Resources at the County of Humboldt. I've been with the county for roughly 11 years. I'm a lifelong native of Humboldt. So my lens here is one, I'm all our panelists over here as their boss, but they definitely did all the work on this. I'm just here to give my perspective, really from the perspective of one of the largest employers in the county, and the impacts that it has to our workers, our ability to recruit and retain all sorts of workers, and the additional impacts on those workers' mental health, physical health, their ability to be at work and bring them their best selves. So I definitely am not an expert in the area of medical, but I can definitely speak to the those impacts on the day-to-day employees that work for the county that are also providing services to the community. Yeah.
Okay. My name is Erick Eschker. I'm a professor of economics at Cal Poly Humboldt. Been in the county for about 27 years now. And my healthcare background, I was formerly a research economist for the American Medical Association. My students and I also were part of a project about 15 years ago where we looked at recruiting physicians and other healthcare providers in Del Norte County. And so we have a report out there that's floating around there. So some experience with strategies for recruitment. And I also want to say that kind of excited here, within the next couple of years, we're hoping that we will have a new major at the university in community health. And one of those courses that students will be taking will be healthcare economics that I'm putting together.
Hello, I am Peggy Murphy. I'm the Interim Program Manager for the Humboldt County Office of Economic Development, which is housed in the County Administrative Office. I'm also the Executive Director for the Humboldt County Workforce Development Board. The lens I'm going to bring to this today is for our work within business attraction and recruitment and retention efforts within the county, as well as our workforce development efforts and how it impacts those.
Good morning. My name is Marlene Hernandez. I am the Program Director for START Services. We are a vendor mental health service provider for individuals with intellectual and developmental disabilities. And the lens that I will be sharing today is going to be based on our current staffing, how medical and behavioral health needs impact their particular needs, but also how it impacts the people that we support and the systems that they are connected to.
Thank you very much for your awesome introductions. Now we're going to take it to our audience members again with another poll from Slido. Please take us a second to answer, because this will inform our questions to our panelists.
Thank you, Rosam. And while you're doing that, I'll just sort of respond to my poll. And you know, I think Zach touched on something that is critically important, and that is that, you know, at least those of us on the panel and those of us that coordinated this event, we are not medical professionals. We are human resources professionals. But again, this idea that we are all impacted by the healthcare situation in Humboldt. And I'll say that I had the idea for this sort of came to me because as part of my job, I analyze and review employee recruitment and retention. And so I was going through our exit survey data, and one of the themes that jumped out at me in terms of why we lost staff was the inability for these folks to have their healthcare needs met. And specifically, it was in many cases not being an inability to secure a primary care physician. It is very difficult to focus and to be engaged at work when you are unable to have your healthcare needs met, and it's even exacerbated if you have a child whose healthcare needs can't get met. And so that really sort of jumped out at me. And through another one of my hats, and I do some work with Providence St. Joseph's, and through the work there, I was able to see how big of an issue recruitment and retention is. And so I sort of felt like I sat in these two spaces where, you know, one as an HR professional and being able to analyze and see the impacts to the workforce there, but then also through the work I do at Providence, seeing how it affects service delivery, their quality and access, which is, again, a point that Supervisor Natalie Arroyo was able to sort of establish in January. So if we go back to this poll, it looks like the overwhelming majority is somewhat. That's actually better than I thought. And then we've got roughly a quarter of folks who feel like no. I think it's really critical, to me at least, is the percentage of yes. Now, I don't know how big this sample size is right now because we don't have the number data, but I think that this is pretty striking. 17. Oh, it's over in the corner. 18 people. Okay. So we have some yeses. It's shifting. I love the intimate nature of this. It's like 18 of my closest friends, 17 of my closest friends. All right. Well, suffice it to say, I think that there's some opportunity for healthcare needs to better be met in Humboldt. So as we sort of move forward, or at least try to, Rosam, you want to try Let's see if it works from that angle. I think we're good. So just to sort of paint a picture, these are some data that we sort of just wanted to throw your way for the benefit of the group. In the top left, this data comes to us from CCRP, Redwood Region Rise, and essentially it just looks at per capita GDP. And how Humboldt is not really keeping pace with GDP growth with the rest of California. This is really no surprise to a lot of folks, probably. But the reason it's included is because it also signifies some economic challenges. The two biggest industries in Humboldt County are really healthcare and public sector work, whether that be, city, county, education. And so I say that just to say, because if those organizations can attract and retain talent, or if they are unable to grow, then that can significantly impact these numbers. And also, if you slide over here, you look at on the top right, you can see in the health metrics comparison that in residents of Humboldt County really outperform, and not in a good way, state and national numbers in key health outcomes. So life expectancy is a little bit lower. Diabetes prevalence not as high, so that's a good, but not by much. If you look at suicide rates are higher in Humboldt, stroke rates, and breast cancer rates. Actually, I should probably also point out, for the benefit of those of you in the audience and those of you, I don't know if folks that are joining us digitally can see, I am not a physician or medical practitioner, even though I have the title of doctor. I'm a PhD, so do not take medical advice from me. I will say that. So, but if you look at this also in the bottom left, if we look at the physician workforce over the last 20 years, it's shrinking. In primary care physicians, in specialists, in surgeons. So this is all just sort of this toxic sort of stew of negative things that are happening. And from my perspective, certainly, and I'm curious to hear from our panel, is I think until we start to address some of these problems, our economic prosperity and our ability for all organizations, specifically non-healthcare organizations, to recruit and retain talent is going to be very challenging at best. So much so that our friends at the Greater Eureka Chamber of Commerce, the membership there identified those are the top three priorities that you saw. Nancy sort of spoke to this earlier during her introduction, and I'm sure that we'll dive a little bit deeper into that. But all of these things are interconnected, as we will see in the afternoon panel, particularly, the healthcare, the housing, health disparities, all of that stuff really connected, and we'll explore that later. So, slide. So,
So now we're going to take it away with a question for our panel, and we'd like to know from our experts on our panel today, what significant impacts have you observed within the community as a result of limited access to medical and behavioral health care? And as you have heard, each of these panelists brings a different lens, so we'll get to hear a variety of responses and hopefully get a sense of how this impacts our community broadly.
But before you answer, I just realized, I told you we'll make mistakes in live TV. I just realized that sort of to connect those things, right? Whether it's the audience panel of, the majority, 72% of folks feeling like their healthcare needs were somewhat met, about 22% saying no. And then if we went back to the first question where we look at, what comes to mind when you think of healthcare options, limited, difficult, those kinds of things. And then when you juxtapose that with some of the data on the previous slide, whether it be economic, whether it be in terms of the shrinking number of primary care physicians, surgeons, and specialists, again, really just to highlight this, from that data perspective, it's definitely a challenging time. So I just wanted to sort of frame that up and tee that up to ask our panelists now we can go forward to the question and give you an opportunity to respond to that. And that is my bad, not Catherine's. I forgot to do something that I should have done. So the morning we're rolling.
And I can restate the question if needed. what significant impacts have you observed within the community as a result of limited access to medical and behavioral health care?
Thank you. So speaking definitely from a perspective of kind of having, supporting staff, supporting individuals with intellectual and developmental disabilities, and also working with the systems that support those individuals. From an employee perspective, we definitely see that when they are seeking any sort of medical or behavioral health needs that cannot be provided within Humboldt County, they are definitely having to leave the area, right? Whether that be towards Redding, towards the Bay Area, to get those needs met. And so what tends to happen is that we notice an increase in stress. We also notice that a lot of the times there's conversations about, well, I have to use vacation time or I have to use sick time. So that's also, something that impacts their overall well-being, because now they're utilizing maybe PTO for medical needs that maybe could have been addressed locally. And so the other thing kind of associating that with stress is that we recognize that, again, working within the START program, we really utilize, positive psychology. We utilize really a biopsychosocial approach that really identifies the biology of an individual, the psychology, and the social aspects, and how all that kind of really contributes to dysregulation, which increases stress and affects their overall, way of performing in life in general and having an overall good life. So going back to the stress, we see that sometimes there are challenges with executive functioning, right? So we'll notice that within our staff, there might be challenges with, coming back into the office after leaving for a couple of days to go get some of those medical needs met, challenges with task initiation, maybe challenges with organization and planning and prioritizing. Again, that's because of the stress level that they had to incur from leaving the county, coming back, and having to get back into rhythm of what they needed to do. And if they had that access here, then we know that we would be able to work with our staff to say, like, well, you have to take a 2-hour break to go get this need met. Wonderful. We'll support with that. And that's not to say that we're not supporting them when they're away. It's just that that's something that's part of it, right? That stress. When I'm thinking about the people that we're supporting, we know that some folks have to travel outside of the area. We recognize that transitions, travel are very triggering for the people that we support because, again, everyone has a different range of disabilities, right? They might have anxiety, depression, on top of having maybe a moderate intellectual disability, on top of having autism. So we're dealing with very complex individuals. And so when it comes to trying to get medical and behavioral needs within the area, sometimes behavioral support is not available. They're on a wait list to get support. And for those medical appointments, let's say if they need to go see a specialist for gastrointestinal challenges, they have to step out and go outside of the county. So this increases crisis for our individuals that we're supporting, right? What also tends to happen for the people that we're supporting is that because of the vulnerabilities and the challenges that they experience, they might miss very important appointments. And when we're thinking about the body and mind, we recognize that if someone is not feeling good in their body, in their physical, body, that's going to impact the way that they behave, right? Behavior is communication. And so with the folks that we're supporting, and just anyone in general, if you're extremely stressed out, you might lose the capacity to be able to communicate and express what it is that you need in that moment. And so other challenges that occur when having to, with these challenges, is our participants are having to go outside of the county and meet new faces, meet new people. So there's a challenge with having to build the trust, or the trust even existing, that rapport, and challenges of feeling understood or even misunderstood. When I think about service providers, school staff, hospital staff, maybe behavioral teams, and what we call, our special supportive living services agencies, or even adult family home agencies, I've noticed that some of the challenges, right, that are very obvious is that sometimes as caregivers, we're putting our needs on the back burner, right? We're not prioritizing our needs because we see that the people that we're supporting really depend on us. And so sometimes we forget to kind of put ourselves first to ensure that we are good for everyone else that we're supporting. So we can see that maybe some of the service providers have less energy, don't have enough time to care for themselves. This increases and is in tandem with those mental health challenges, right? Where we'll see a little bit of depression, we'll see a little bit of that anxiety, and all that, again, with even depleting compassion. And all that, it goes back to the executive functioning, right? Where they don't have the mental capacity to really organize or plan because they're experiencing their own challenges that are going unaddressed.
Thank you, Marlene.
Excellent points. Feed right well into mine. Wanted to share with you some national data, and Erick might talk about this a little bit too, but the Deloitte Health Equity Institute released a 2023 survey that says inequities and access to healthcare account for $42 billion of lost productivity annually. And it accounts for tens of billions of dollars in treatment required because people delayed getting their health care, things like that. That's at a national level. I couldn't find the local numbers, but maybe, I don't know if Erick has those. But I just wanted to frame it that it's it's not just in Humboldt, but it's exacerbated here for sure. A couple of the things that we've found and seen in real time, and you probably have too. These are not rocket science answers, but some of the big challenges for business, and I would say nonprofits, because they're business too, as well as our county and other public institutions. Increased costs are a major impact on businesses. I'll use business as a kind of a global term. So healthcare premiums, we all know that healthcare premiums are going through the roof. All businesses that have 50 or more employees are required to offer health insurance, I think, to full-time employees. And this hits them directly. A lot of small businesses and organizations, our organization has 5 staff. We offer healthcare insurance to our full-time employees. But we have to look very carefully about what we can offer because of the cost of healthcare premiums. That hits a business's bottom line. Lost productivity is another big thing. I'll talk about that a little bit in terms of absenteeism. So when folks have to, and this is again really exacerbated in Humboldt County, when people are out because they're sick, it does, Marlene gave some good examples. Sometimes it takes them time to get kind of reoriented in the workplace when they come back. But it's even more so because so many people have to travel to get their health care. I'll give you an example from my own office. We have an employee who was injured, and it was a pretty serious injury, had to have surgery, things like that. And she was out of the office for several months. We set it up so she could work from home, but she could only work from home part-time immediately after her surgery. We lost, I would say, probably 2 months of productivity from that employee. And a big part of it was because she had to get her treatment down south in Santa Rosa. And other people who have particular health needs often have to travel. So it increases the rate of absenteeism within our businesses and organizations. And on a related note, presenteeism, so people being sick but still showing up to work, is another big problem for businesses. I was talking with a local business owner who has predominantly young employees, and even though she offers insurance to those who work full time, they often decline it. And those who aren't eligible for health insurance, they're scrambling to get health care. They're the folks who go to the urgent care or the ER because they don't have consistent health care providers. And although we're required to offer 8 days of sick leave for part-time employees, and they burn through it. and they say, you know what, I can't miss any more unpaid days, or I can't have any more unpaid days. So I'm going to show up to work and I'm going to be sick, and I might get my colleagues sick. So that's presenteeism. There is a lot more. I think that's a summary of what I wanted to share. Economic growth impacts. It impacts the economic health of our community. I'll leave that to Erick to talk about. It's a real financial burden to our employees to have increased medical debt because of the lack of access to health care, and having to pay for travel, that type of thing makes it really difficult. And again, attracting and retaining employees is tough, because when I moved here, I was told you can expect to not have a primary care provider for probably a year or two. I was really fortunate, and I was able to get one within 6 months. And my sister connected me to her dentist. So I got into a dentist within a year. But that was really the exception. So the attracting and retaining employees is tough because of the lack of healthcare here. It was mentioned before. I'm sure it'll come up again and again and again. And it's just even more so because of our remoteness. I'll talk about a program that we are working on with the healthcare community called Home in Humboldt a little bit later, that I think is a hopeful point to help attract and retain folks here. But I'll hold that for another part and pass this on to Peggy.
Thank you, Nancy.
Both of those teed up a lot of great stuff for me to talk about. Our office with the Humboldt County Office of Economic Development works in 3 basic tiers that interact and overlap in many ways, and that's business, workforce, and community. And so from the business lens, Nancy talked about a lot of great stuff about business retention, and that's definitely a piece we look at. But what we also look at is business attraction and recruitment. And so that means bringing in businesses that want to put a center here, a manufacturing facility here, something here that will increase industry and workforce. And what we find is, second only to the question about transportation in and out of the county, is the question about healthcare for employees. And so that tends to be a turning point. Sometimes what we see, we had a very specific business we were talking to a few years back that needed very specialized healthcare to be able to put their center here. And that was in needing a bariatric chamber and needing direct access to it regularly. And once that became not really an option, they were not interested, and I believe they went to the San Luis Obispo area in the end. And so even that aspect impacts our ability to increase industry in the area and to attract growth for sectors where we're looking to increase living wage and thriving wage jobs, which then leads to the workforce piece. And so our Humboldt County Workforce Development Board is working on getting a living wage study done to really understand what the standard concept of living wage means for a worker in Humboldt County. Does it mean that you can have a house payment? Can you also have a car payment? Can you buy clothes every month in addition to your groceries? But the thing that we know about a living wage is that it's typically built off of concepts of average costs of things. And for our area, when our workers are having to drive out of the area, spend multiple nights in a hotel to stay and see healthcare providers, get specialized healthcare out of the area, potentially out of network for their insurance, those costs are not always built into the concept of a living wage. We also know that in our area, a lot of our jobs are below living wage currently. And so the concept of working a below living wage job, plus having to factor in costs to go out of the area for healthcare, really impacts our workers' ability to stay in our region and continue to do those jobs. And so we do see people leave our area to be closer to the healthcare they need, especially if they're in a situation. We have one very specific one where an individual had a child that needed regular healthcare out of the area. It was cheaper for them to move to an area closer to that healthcare than for them to stay locally, continue maintain their job here, and continue to have to do those regular trips. There's some other impacts on workforce and the solutions we are working on with workforce that actually impact us, but I'll talk about that a little bit later as well. And then one thing that I think Nancy's conversation about the project she is working on will also lead to is the public image of healthcare in Humboldt County and how that impacts workforce recruiting as well as business attraction recruitment. And our office completes what's called a comprehensive economic development strategy every 4 years. As part of that, we did a survey. It was a very short period we had the survey open for, unfortunately, due to some outside limitations. But we received 801 responses. 723 of those responses said that the lack of healthcare in Humboldt County is a major impact to them. That's huge. And so that then extrapolates out into what people hear about Humboldt, what they know about Humboldt. And as we're trying to attract and recruit businesses and workers, they're hitting this wall of you won't get healthcare. You're going to need to go out of the area for healthcare. And I know that's something Nancy's working on, and so I'm hoping later she'll be able to speak a little bit to that.
Thank you. On the healthcare in the county, I don't have a lot of particular insight on the numbers. A lot my colleagues here and on campus at CCRP and other places have assembled a lot of data on measures of physicians per capita, things like that. That's what I'd like to look at. What I can say about Humboldt County is that just like when we look at Del Norte, it's the second largest employer, healthcare in general. We've got some big employers, some of the hospitals here, and healthcare in general. So it's big in the county. Of course, that might make you think, do we really have a shortage when compared to other big cities? Healthcare is not necessarily the second largest employer. But there's a difference between employing a whole bunch of people to run a business, from especially a lot of people who aren't on the front lines of providing healthcare, to measures such as healthcare provider per capita. That's what I would want to look at. But it's big in the county already. Presumably there are large, what we call multiplier effects. The multiplier effects in the county mean that when you attract a healthcare worker, they're generally well paid, and they will generally spend in the community. So you have big multiplier effects as a result. So it's a good thing. This is an industry that, if we can attract more people, will boost the economy overall, aside from just the notion of making it easier to recruit people and attracting talent. But just in terms of spending money, these tend to be good jobs, well-paid jobs, and so that's good for the local economy. Going into a couple personal stories, which this is very relevant. When I came to Humboldt County, after I came, my new wife at the time, I was looking for trying to find a provider. I had insurance through the university, fairly solid insurance, and I had to do the trick of, I brought her to introduce her to my physician, my doctor, and I said, Doc, this is my new wife, and hey, by the way, I'm not just introducing you. I'm asking you now, would you take her on as a, primary, would you be her primary care doc? And of course, he couldn't say no at that point. So it's very real in the county here. When my dentist retired a number of years ago, I called a dozen, maybe 20 dentists in the area. Couldn't find anybody who was accepting new patients. I had insurance, right? And couldn't find that. Insurance, by the way, that's something important. That's perhaps part of this discussion as well. Providers, insurance carriers on the North Coast. When I originally came to the area, Humboldt State at the time, if you, in terms of selecting your healthcare plan, your insurance company through HR, there was a list. And what I was told was that every insurance company there, if they were going to provide insurance to any CSU campus, they had to provide it to all campuses. That's what I was told. That went away after a few years, maybe 20 years ago already now. And when that went away, poof, the next year, all of our insurance, it went away. And we had a very limited number of, which insurance company do you want, health insurer do you want? And so part of the issue here, I think, is having health insurance companies. I know, for instance, students are surprised at the university when they have to go for treatment somewhere, some medical service, and they have Kaiser. Their parents have Kaiser, and there's nothing up here on the North Coast. What do? And so I hear this all the time. So that's also part of it. So here's a question that I'm just going to leave, and we can maybe come back to this. How bad is it on the North Coast here in Humboldt County? So I don't want to be all doom and gloom. My sense of things is that even though I just spoke about primary care, we do have a level of service here that many parts of what you would call rural America are envious of, okay? And we do have specialized services that might be a 4, 5, 6 hour drive away. Again, compared to many other areas of rural America, they may be very envious of what we have. On the other hand, we are certainly not in an urban area. We are not near a teaching university, a medical school, where they're doing some cutting edge research, right? And all of us know people, probably ourselves, who have had to leave the county to receive specialized treatment for ourselves, a child, a parent, whoever that might be. So I'd be curious to know, where do we fall in relation to other rural versus urban areas in the county, and also compared to other places in California? How do we fare? How do we rank there? That might be instructive for when we talk to strategies, which I know is not necessarily the purpose of this, but that's what we all want to talk about, is what can we do? That's what I'll say for now.
Well, the rest of the panel really hit on a lot of things that I thought of, so I'll try not to be too repetitive. And I don't have any notes. I like to be a little more organic, off the cuff. So if I start to ramble, I'll try to hold me back if that happens. But when I was thinking about this question, and the core of it being what are the significant impacts that I see, particularly in my role, I kept kind of going down the rabbit hole further and further. And where I kind of landed was thinking about that significant impact, and the word community is really, as a public entity, our role is very often has nothing to do with revenue and trying to bring in more money. It's really providing services to the community. And so, in thinking about that, the impact that I see with our staff is really our service level to community members, whether that's our ability to provide those services or the cost of those services. What we see a lot is when people are out sick, more often have to take long leaves in places that we were required to do things like in our jail or in Sempervirens. We can't just not have someone there. So what then happens is that another person has to cover, and that's overtime. So that's more tax dollars being spent. If we were able to fill more positions and not have to do that, it wouldn't be as costly. And again, those are all public dollars that we're using to do that. Part of this, when I thought of this, was kind of having an opportunity to humanize public employees. I think a lot of times, myself included, before I was a government drone, is that a lot of folks, it's kind of a mystified thing, the government employment. We know that they're there, but what are they always doing, and what are they working on? And they're human beings, right? And so these people are working in a lot of times very, very stressful environments. And the public, rightfully so, expects a high level of service. This is your tax dollars that are doing these things. But those people are human beings, and as they're working on things like deputy sheriffs having to deal with, the things that they deal with, or working in the correctional facilities, or being a mental health clinician or provider, that takes a really large toll. And I think it was mentioned that a lot of times people get into that field to take care of their community. We're not usually doing this. It's probably not a secret that working in the public sector, you're not doing that to get rich. We definitely don't pay the top dollar in comparison to, say, the private sector in certain areas. And so those people usually are there for that purpose. And what happens is that they don't take care of themselves. It's sort of that like fatigue of trauma, of taking on the trauma from others. So what happens then is, if they're not able to access mental health services or physical health services, dental health services. It just creates this bigger stressor on them that a lot of times they're not going to necessarily want to try to seek out, because they know if they're gone, that's going to be a strain on the community member that needs their service, or their coworkers who are going to have to come in and work that additional overtime, because there are certain jobs where, hey, if you don't show up, the work will wait. Again, that is still a service level effect on the public of not getting their application met, or not getting their appointment that they need, or not getting their cash assistance or whatever that might be. But there are also places where we literally cannot have someone not be there. So that then turns into calling people in, paying them additional money, which does kind of hit the bottom line. Even though we're not a for-profit business, it does start hitting that bottom line in the sense of the public's tax dollars. So that was the thing that I thought of the most, of what is that impact. And it really comes to that, our ability to give the service. And then when people are showing up to work, if they're not addressing the big one I see is, it's across the board, but like access to mental health. So our employees take on all this stress and all this trauma with these very stressful jobs, and they're still having to show up to work every day. But are they really bringing their true best self when they have all this other stuff going on with them? They're going to do their best, but if they maybe had better access and were able to handle those things for themselves, it's kind of like the air mask when you're on the plane, right? If you're taking care of yourself first, then you're going to be able to provide your best self to that client, to that patron, to that person. So as I thought about this, again, not being a health professional, what in our role really hit home for me on this was really, how is this impacting the people that we're supposed to be serving? If we had better access, and the word access keeps coming up, I do think we would have more people in jobs. We have a lot of people who come here because they love it here. They don't necessarily come and work for the county of Humboldt because it's like, again, they're going to come make the big bucks. They love this area. They love what we have to offer here. They understand that they're not going to be able to make as much money, but we have seen, anecdotally, but I think there's enough with the data that Dr. Clark mentioned that we do have employees who have had to make that very hard decision to leave this wonderful place that we all live in and we love, because they just simply couldn't access those services that they needed. These are things like attorneys. So again, sort of demystifying of how many attorneys do they have there in the DA's office and the public defender, and what are they doing all day? And I'm sure you've heard from time to time that they're overworked and very stressed, and those jobs are stressful anyway, but then exacerbate that when that then has an impact on the community of, are they going to be able to try those cases? Are they going to be able to properly give those public defender services to folks that can't seek private counsel, all the way to the folks that are working in our jail who maybe it's one person overseeing an entire unit of inmates by themselves because there simply just aren't enough people to have multiple people in that unit because they have to meet these mandates. So again, I'm kind of getting on that rambling route here, but really I thought this was a good opportunity to make it very humanized to folks listening, and also really hit on that impact that the folks that are working, I would say, for in the grand scheme of things, they really want to do the best for the community. But this just makes it that much harder, and it ultimately impacts your ability to get the services that you're trying to get.
Thank you, Zach. So let me just say, first of all, that I am super excited because when we put this panel together, the range of expertise and perspective we felt like would be really beneficial to the conversation. And boy, you all did not disappoint. Just naturally, you all just sort of built off of each other, and there was this natural flow. And I love that. I got a quick follow-up for you, Zach. One of the things that I have sort of observed as I've been working with Providence and with my physician colleagues, when you talk about physician recruitment and retention, there's a lot that goes into that, right? Like if you look at the profile, these are highly educated folks performing a critical service. They are highly compensated. They're in demand. And so it's not just about making your hospital or your community attractive to that physician, but there are other considerations, right? Like, will their spouse have employment opportunities? Will their kids have a school that aligns with their values or their needs? Can they get the care that they need? Are there folks that share similar interests and hobbies? And so I want to ask you, like just in your role as the director of HR, have you observed any similarities in that when it comes to recruiting, again, higher educated position, recruiting for higher educated positions, specialists, etc.? So I wonder if you could shed some light on that.
Yeah, so if I understand the question, have I seen that similar thing that you're seeing at Providence?
Exactly, like I couldn't, is there a role for my spouse? Or I'm interested maybe in coming to work for the county, but what's my wife going to do? She's also, an attorney or a physician or whatever. So
Absolutely, yeah. I think we have a wide range of employees. Those that are younger folks that don't have kids or spouses. I think though our straw person per se is usually someone that has a spouse and has children. That's usually who you're seeing, particularly when you have people that are further along in their careers that have those special licensures or certifications or professional level folks. I'd say it's pretty rare to have someone come in that's just a person who just needs to have their needs met. And I don't want to steal any thunder, so I'll let someone else talk about some great things happening around that. But I think that is a need as well, is that the considerations for the spouse, the children. One of the big things, I'll just use an example for myself, is I've had 2 children that have needed specialized care. I've had to go to UCSF for that. I feel, as you mentioned, very lucky that it's only 5 hours away to get there, and that I have the life flight benefit, and I pay for that to make sure we can get there. But so I actually feel very lucky being a rural community to have that access. But that again created a strain on my family, not just me, that I did have to take additional time away and did have to do that. So I do think that we do see that as well in the public sector, particularly when you're getting into those areas where people are further along in their career, they're getting married, they're looking to start a family, they're looking to, they're making enough money at that point to maybe consider buying a home and starting a family. But those are all considerations that they're going to take into account. And we have seen, again, anecdotally, I have a number of situations I've seen where they've been very honest that I really want to stay here, but I just don't have all those pieces in place that I need to build that life that I'm looking for. Even though I've kind of pushed so hard to keep myself here, I've just hit that wall where I got to go somewhere else to get those services that I need.
thank you, sir. Oh, Dr. Eschker, please.
Well, just to sort of follow up on that, when we looked at Del Norte County, the recruitment issue with physicians was, there were many things, but you could think of this as an amenity that even applies to healthcare providers. There's the natural environment, the schools, the weather. Okay, so some people hate our weather, some people like it. I like it more and more. And at the thought of maybe being in an area where it might be 100 degrees in the summer, I like less and less. But it's not for everybody, but it's pleasant. It's not, brutal winters, etc. But the healthcare, the availability of healthcare is part of the landscape, and that's an amenity. So that's gonna factor into anybody's decision to come here or stay here, including healthcare providers. It used to be with healthcare providers as physicians, the issue was, where can the doctor's wife spend the money? Well, our mall is closing, this and that. I don't know if that's an issue anymore with online and Amazon. And today the issue is the trailing spouse. 2 doctors, right? Where do they both get a job? Or a doctor and attorney, right? So 2 people in the workforce now, can you secure that employment? The veto may not come from that one healthcare provider, doctor, or nurse that you're trying to get. The veto may come from their spouse or their children, okay? And this is the classic, this is rural America problems that's been going on for years, how the sort of slow death of rural America. This is a broader issue than just healthcare. To what degree can places like Humboldt County, which I think have unique advantages, again, I like to think of us as being, I tell my students, and when I try to recruit students, we're really small urban, you could be rural, but maybe small urban may attract to some people that might be attractive. The notion that we still have things going on, we still have some nightlife, we still have restaurants. We're not as rural as other parts of America. And of course, some people will want to be as alone in the woods as possible. But I think the big question for me is to what degree is our recruitment issues with healthcare providers, where do we place? Is that just rural America having problems? Are we better off, worse off? That would be very interesting to know.
I was just going to say, Peggy, I saw you and Zach was speaking, nodding your head, so I felt like you wanted to weigh in on something, so please.
There's so many avenues for all of this. I think one thing that I think about a lot, especially with the work we do through the Workforce Development Board that's direct participant touching, is really understanding what our local needs are. And a lot of the conversation we have is about that specialized healthcare need and what we need there. But when we look, we get a report run whenever we want, but we try to get it quarterly on our different industries that we target, with healthcare being clearly one of the primary. And it's a report that's run on how many unique job listings occur in the area in any given quarter. I just had it run in May, and so for that quarter, there was 404 unique job postings for healthcare in Humboldt County. The thing that's interesting, though, is that while the specialty is a huge aspect of it, almost 300 of those were actually in your entry level to like lower mid-level range. So it's not just a question about how we build up that specialty care, it's about how we train to the lower positions that then can have incumbent worker training to move them up. And that's a lot of the work we're trying to do at the workforce board level. The thing I think I was probably nodding my head to with both of you is that concept of, again, of the having to go out of the area, spend your money or your PTO or whatnot to go out of the area. And when we're talking about our local industries and the way that the projected growth is over the next 10 years, that biggest growth is actually in those lower entry level jobs for most of our top tier industries. And so we're talking about people that aren't going to be making as much, don't have as much expendable cash. It goes back to the death of rural America comment, because the reality there is that once you're spending all that money to go out of the area, using your vacation time, your sick time, your expendable cash, you're not going out to eat. You're not going and shopping locally. And so that's how we end up with a dead mall, and how we end up with restaurants that are closing, that are coming to Nancy asking for support. And so I think, yeah, it's a much bigger issue. It has to do with housing, infrastructure, transportation. But I do think that we do have a lot of opportunity between things that are happening at the chamber, things that are happening through Cal Poly with Redwood Region Rise, with the county's efforts in workforce, and with our comprehensive economic development strategy to tackle some of these issues. But it's not as simple as recruiting one individual. It's the entire structure that needs to be looked at.
Such a good point. And there, just for the record, like there are a lot of really smart people that are like working on this issue. I do wonder, and maybe we could talk about it later, because I want to give my colleagues, obviously want to hear from Nancy, but I want to give my colleagues a chance to weigh in. But one question that always comes into my mind is, where there's a lot of folks working on this, how do we all work together, or coordinate all of our efforts in the same direction? And Nancy, I know that you are working on a project that aims to do that as well. This is a time you can talk about that, or we can save it for later. But that's just always sort of something that's in my mind. So I wanted to throw that out there.
Sure. Thanks for creating the opening for me, Jeremy. I will say about a year and a half ago, I was approached by Michael Kellerman, who's the chief executive at Providence, from when he was brand new in the area. He came from San Luis Obispo, where their chamber had a program. It's called SOAR, and it is designed to help healthcare providers as well as other businesses to recruit and retain professionals by providing a kind of concierge service to folks who are looking at moving here, or they land here and they need to know everything from where do I get my car fixed, to which schools are the best, to how can I connect with the right realtor, all the questions that we have when we're moving to the area. We are where we are in that right now. We had a meeting on May 14th. We had the CEOs, not just representatives, but the CEOs of nearly all of the major healthcare systems came to the table, along with senior folks from Cal Poly, CR, the county. I think City of Eureka is going to be part of it, Coast Guard. And it's really open to anybody who wants to be part of this conversation about creating this program called Home in Humboldt. It's starting to gain real traction. So there's a lot of energy behind it. We have our next meeting in June, I think it's June 24th. We'll be bringing together the same people to discuss this. We are in the process of developing a strategic plan and figuring out the resources it'll take to make this happen. We want to make sure that this is a serious program, that this isn't just some nice little welcome wagon level kind of a program. Part of it that they're asking is that we collaborate with, for example, the county. You may or may not realize that the same amenities that folks here are looking for are the same that tourists, for example, are looking for. So how can we partner with the county's tourism work to improve the profile of Humboldt as a place online, so that we don't have the cachet of Murder Mountain and scary and things like that. So that's, one of them, but also how do we help people feel truly at home? How do we help them grow roots here? And how can we support them on an ongoing basis? Obviously, we're not going to be recruiting people, but we'll work in tandem with folks who are to support those folks that they want to bring in. And once they land, what do they need? I feel it's a little daunting. And there's so much energy behind it. It's a little intimidating at the moment, so we're figuring it out. But we're really excited. I think because there's so much momentum behind it, it's going to be really a wonderful asset for our community. If anybody's interested in funding it, I'm looking for multi-year investments. So, but it's going to be helpful. This does not mitigate some of the issues that we have in our community. I'll bring up, you can't have a conversation around community development and recruitment and such without talking about housing. In our study in 2023, when we surveyed our businesses, our member businesses, you saw that our number 3 concern of businesses is housing. And we asked some more detailed questions about housing. I'll share those results with you. A majority, 54%, stated that their employees struggle to find adequate, affordable housing. So more than half of them say their employees are struggling with housing. They nearly half, 49%, said housing issues make staffing their business or organization more difficult. So bringing in folks, because of the housing shortages, it's challenging. And one of the really challenging, probably my least favorite statistic that surfaced through this entire survey was that 18% of the local businesses who responded, again, this was about 125 businesses, 18% said that they had at least one employee in the last 12 months who was unhoused. So they were couch surfing, they were living in their car, living on the streets. 18% of our businesses said that they have employees who were unhoused. And then an additional 11% said that they were not sure. Let that sink in. That's a big deal. So housing, healthcare, education, the whole thing, they all are come wrapped in a wicked problem rich package. So as we're talking about, attracting and retaining employees for healthcare, for education, for, various industries, we're going to be looking at how we can advocate for more housing, for better amenities. And I took a sneak peek at one of the questions that's been submitted. Is there any role for residents to be activists for improvement. Support the initiatives that are coming up that are pro housing, and another big thing: shop local, because we want our local businesses to stay here. I got my coffee at Jetter Bean this morning, and the owner of Jetter Bean may or may not be my sister, but but we have Starbucks that's moving in. It's gaining market when our local businesses, if you go to Familia, if you go to, any of our local, we have some really wonderful coffee, just coffee houses. We need to support local, because those are the amenities that people moving here want to see. It'll help mitigate our empty storefronts. It will strengthen our economy overall. That is something that has an impact on all of this. Like I said, it's a big, wicked problem, tied in knots together. But that's something that we can do every day, is shopping local.
Thank you, Nancy. I will say that I think it's clear, if it wasn't before, that this issue is multifaceted. I think there are a lot of directions we can go with this conversation. And honestly, I was going in so many directions as you were speaking. You brought up so much in that short time that you were talking. But one thing that I hope to kind of circle back to, and maybe we can start with Marlene on this, is if each of you can kind of expand to the knowledge that you have on the impacts to the community through families. I think each of you have talked briefly about how there's this ripple effect and extension through children, through partners, and how that's showing up, and obviously having a big impact on our economy. But not only expand on those impacts, but also talk about the work that you're doing to support families.
So I did want to touch back a little bit, and it's going to circle back to what you're asking, when it comes to like infrastructure, entry-level positions, and housing. That is something that we definitely see a big impact, right? A lot of the individuals that we're working with, the paid supports that they are receiving are all entry-level positions. And so we recognize that that's what it is, but a lot of the times when we want to talk about the difficulties and the challenges of working with human beings that have very complex needs, I think it's important that we take a look at, again, the internal workings within our community to see how we can how we can promote wellness and financial security within the folks that are already within the county, within our community. When it comes to housing, I know there's a huge impact on the people that we support. A lot of the times, if there isn't any housing available due to, let's say, maybe because of some challenges with communication and behavioral needs, that an individual is becoming evicted from a shared group home or a shared home, they're sending them a lot of the times to, motels. That's the option, the only thing that it really exists. And sometimes if there's very difficult challenges, they end up within the criminal justice system. And even within that, sometimes if they're not going to the jail, they're going to our psychiatric facility. And so what ends up happening is that individuals get stuck within that system. One, because there's no avenue, there's no housing available. So we tend to house people in jails or at a psychiatric facility because we don't have the housing and we don't have the capacity within our community to be able to provide that support. So there's limited positions, right, that can really be filled to support these individuals. A lot of the times, some of the individuals that we support need 24/7 support. So the capacity, the workforce doesn't exist. Everyone is kind of maxed out. And it kind of goes back to a little bit about, folks having to call out or needing to take care of themselves. That's where then we see a little bit of that overtime coming in, or folks really stretching themselves thin to just try to provide services to the people that they support, and because they're trying to hold on to their jobs. And so some of the ripple effects that we are seeing within schools. We were just talking about an individual the other day, yesterday actually, about how the teacher has a child with unique needs as well, that has a lot of challenging behaviors, and because of the challenging, the complex needs of the child, the teacher is leaving the classroom quite often during the week to go support his son. That just touches on the fact that there's not enough behavioral support for our professionals within the workforce. So the teacher is stepping outside of his work to go support his child, and then what ends up happening is that maybe the behavioral aides or a substitute has to come in, and as we talked about earlier, transitions, challenges, and changes in routine can be very triggering for the people that we support. So now we're having our individuals that are experiencing challenges within the classroom, and that also kind of then impacts everyone else that's in that environment. And so that's just one example, right? Limited staff. The other aspect to that is that teachers don't always have the capacity to provide that behavioral support. They're not one-on-one behavioral support techs, right? Their ratio is what, 1 to 25 students, maybe a little less, maybe more. And so they don't have the capacity to be able to kind of take away from whatever lessons they're trying to address, and then provide support over here. When I think about emergency services, I feel like sometimes we can be less proactive and more reactive, which is increasing, again, those crises. We need to be able to, and this is some of the work that we do, right, through the START program. One of our roles and goals is to really create partnerships and collaborate with our community partners. We have a great partnership with the Eureka Police Department. Our clinical director, Dr. Wendy White, conducts regular trainings in tandem with Commander LaFrance to ensure that we are providing information and education regarding mental health needs in people specifically with intellectual and developmental disabilities, right? Because it's always going to present a little differently. And also, when I just think of just law enforcement in general, it's a very stressful job already. So we know that there's going to be challenges with maybe impulse and impulse control, emotional regulation, and so really connecting with them to again, just coach a lot around the vulnerabilities that people might be experiencing and what to kind of look for is really one way of trying to just build capacity within our community and our partners to ensure that we're doing the best that we can as a community to look out for one another.
Thank you, Marlene.
Thank you. Most of you have spoken about the interconnectedness or interrelatedness of various aspects of this crisis, but also of other unmet needs in our communities, such as housing or food insecurity. And I think that is very important because in order to talk about sustainable solutions, right, we need to understand the impacts fully of the limited accessibility to healthcare. And so going back to that, to those impacts, I would like for you to talk about two things. And the reason I'm combining two questions is because it's not applicable to all of you, and also because I want to leave some time for the audience to ask some questions. That first question is to, if you can speak to opportunity cost. So basically, when we are spending resources on healthcare access, it means that we forego our second best option. And Peggy, you talked about it at the individual level. So just to sum up, you stated that when somebody goes out of the area and is spending a lot of the personal resources, either time or money, it means that they don't spend that energy, that time and money on other things that could help the community. So globally, at the institutional level, organizational levels, or county-wide levels, what are we foregoing when we spend so much time and energy and resources on this issue of limited healthcare? And that's not applicable to all of you. So for those who can speak to also, how does it affect demographics? Somebody talked about our youth, right? They're our future, right? However, we are facing an aging demographic, and I'm really interested to know how limited healthcare access is contributing to that aging population, right? I took a peek at our demographics, and birth rates are not necessarily going down, but we are having an exodus of youth in. We were talking about disruptions to workforce, right? That disrupts our workforce. So for those of you who can speak to it, how does limited healthcare contribute to that exodus of youth?
I'm going to try to tackle the first part of that question because this is something that I think, especially in our office being economic development, we get the question not so pointed, which I actually appreciate how direct that was. But we often get the "you've supported this industry, why are you not supporting this industry?" question. And similar to everyone sitting here, probably everyone in the audience, funds are limited, staffing is limited. And so we have to make conscious efforts to be tackling some of the bigger ticket items and spreading the ability to do so out. And so we try to target our approaches through data and analyses first and foremost that inform us of where those needs are. We used to do what's called the targets of industry that would tell us what our biggest growth opportunities and industries were. This last year, we did what was called Project Rebound that did the basic same thing and found that our main target industries are education and training, healthcare, financial services, agriculture, arts, hospitality and tourism, construction, renewable energy, aquaculture, and fisheries. That doesn't touch those like cross-cutting needs such as broadband, childcare, which we haven't touched yet, but actually kind of goes back to the question prior. And so that concept of that multifaceted approach, some of the ways we deal with it so not to necessarily make other areas suffer is we look to partner entities. So for childcare, for example, the county funded a childcare initiative that looked into some different strategies for childcare and offered incentives for childcare businesses and people that were able to operate during COVID and continue operating after, including increasing the wages. But out of that came some pretty shocking numbers. And I don't want to misquote the numbers, but it was something unbelievable. Like we're only meeting 10% of the childcare need in our county. That is a workforce impact in the long run. And so that tells us in our office, we need to figure out solutions to training a workforce to be able to handle our childcare needs. And so sometimes the approach doesn't look like we're doing anything right off the bat, which is always the struggle period, right? We have the community coming to us and being like, why aren't you doing anything? Why aren't you doing anything? And we're like, we're trying to get the numbers. We're trying to understand what the actual impact is so we know how to target that because the resources are scarce. And we need to know what we're trying to target and how we do that so that ball doesn't always drop. But it does mean that at various times, the activities wane, and at other times we're looking at partners to make sure that they are doing the pieces we can't do. And so one thing about our community is we're very good at working together to try to tackle issues. I'm not sure that fully answered your question, but tried to.
Well, I actually have this number here. Between the census of 2010 and 2020, Humboldt County grew at 1%, California grew at 6% on average. So that's a considerable difference. We may actually be leading the wave of population decline. In other words, we may be learning lessons here that LA and San Francisco are going to learn a little bit later. I don't know. That's just speculation. But a strong, healthy economy, a big part of that is growth and population growth. That feels very different than population decline. And worldwide, we're going to, well, that'll be after my lifetime, but next 100 years, we're going to see that. And that's going to be very challenging for a lot of areas. I think about, like, in terms of demographics, who is really concerned about healthcare? Everybody is. And if they have, if you have if you're sick, then you are concerned about it. But aside from that, there are groups that are going to be more concerned about healthcare. As retirees in general use a lot more healthcare. I think that's all my parents do. They go to every week. They tell me the different doctor that they visited. If you're chronically ill, obviously, and if you have a if you have a chronic disease, disabled people, people with families, women that may be pregnant, may become pregnant or are thinking about that. That's when it kicks in. Generally, younger, healthy people, they don't really consider healthcare. It's not that much of an issue. But those are some of the folks that we may have difficulty attracting or retaining with the healthcare in particular. And I think, to the degree that in particular, families that are thinking about growing and having children, to the degree that that's important with workforce folks in that age range, that's going to be particularly relevant.
I definitely can't speak to all of that, but I think I can kind of mash both Katherine and Rosam's questions together. There was speaking of the demographics and the impacts, and then what are we doing to try to combat those impacts. At the county, and this isn't something that can really be addressed all the time, just based on the nature of the work. But we have seen a pretty stark change in the expectations of our workforce. I think when I was thinking about that, of access, bringing it back to healthcare access, in this current moment, one of our analysts is out of the area seeking dental care because her children can't get dental care here, because she hasn't been able to get connected with a provider. And so rather than say, well, you have to use up your PTO banks and go and then I'm losing productivity of someone being gone for a week because she has to go there one day and then find a place to stay, and is remote work. Not everyone loves that. That is a big shift that we've seen in the workforce. The private sector has been doing it for a long time. The public sector is starting to get on board with it a little bit. That does create a strain on supervisors and managers to know where their workers are. Are they working? What are they doing? There's really more supervision that needs to occur when someone's remote versus in person, for the most part. So things like that, flexibility in schedule. The standard 9 to 5 is kind of a foregone thing in this day and age, with the access to childcare and the cost of childcare, and then the ability to work with folks of, you can have sort of a wonky schedule where you come in at this time on this day and leave at this time on this day and have a longer lunch and flex here and flex there. I feel lucky in our role in HR, we have a lot of flexibility in that. Not everyone has that. That's something that I think we've really tried to push with our various departments. The County of Humboldt has between 22 and 2,300 employees across a variety of different types of work. So again, it can't always work that way, but as much as we can, that kind of shift in the workforce and I've even seen it in the time I've been the HR director for 3 years, but I've been with the county for almost 11, in HR for about 8. The dramatic shift that occurred, particularly during the times of COVID, we had to make shifts with those things, but the expectations of the workforce and really a paradigm shift of not what can the person do for us as an employer, but what can we do for them? Because frankly, with the way the world kind of flopped on its head during the COVID era, it was really hard to find workers because they were looking for jobs in other places. And so having to find ways, back to the question of how do we support that, being extremely, extremely flexible. And so I would encourage other employers in the private and public sector to be looking at. We're seeing things like right now, I believe the city of Fortuna is looking at a 32-hour work week, which is probably something a lot of us would think, yeah, right. Well, we're seeing these things like that where we're having to get very creative during times of scarcity of resources, that we can keep workers happy. They can still be supporting their families, getting their needs met, basically finding anything we can do. So those are kind of things that I thought of when I heard that question of how can we basically bend over backwards to ensure that our employees can get the services that they need, maintain their job, and not have some significant impact, or at least mitigate some of that impact on those resources that they have available to them.
If I could just add a question here. Remote work, is that going to lead to more people in Humboldt County working elsewhere? The notion that now we can attract people to live here, but their job is in the Bay Area, but they can live here. Or is it going to mean more people are working in Humboldt County, but they live in Massachusetts or they live in Chicago and they're not here? I don't know which way that goes.
I will say we looked into numbers of remote work when we did our local and regional workforce plans recently, and our numbers significantly declined since COVID, which I think is a bit obvious. But the bigger decline was actually in local workers working remotely. And so part of the conversation we try to have with businesses when we do our workforce work is the conversation of building in that flexibility that Zach was speaking to. And that's not necessarily innate for a lot of these business owners that have not been doing it that way for a long time. So it's also a change management conversation about how to change how businesses deal with their workforce as well.
Can I go a little off our protocols here? You know me.
Please go for it.
Awesome. You guys know me. And I might put somebody on the spot. No? Okay. But when that was being discussed, one of our friends who works at Cal Poly was shaking her head no to the remote work. And I wish, was I understanding that correctly? Oh, that's right. You're at a different college, CR, right? Okay, I just wanted to hear that because you were so emphatic with no. Okay, thank you for indulging me.
And Nancy, we will be providing a Q&A for the audience shortly too. So but please share. You have more to share.
I'll wait for the Q&A.
All right. Well, at this moment, we will shift gears and provide an opportunity for our audience to ask questions. And we're able to see a live feed of what those questions are. So we'll just give everybody a moment to enter their questions if we have other folks that want to ask questions. But let me just take a moment to read these real quickly. I heard somebody mention this earlier, but one of the questions that we have from our audience is there any role for residents to be activists for improvement? And I'm thinking that this is improvement to healthcare and actually maybe the entire system. I think we've heard from our panelists just how big the impacts are and how a lot of our other systems really have to support the lack of access to healthcare. And somebody mentioned bending over backwards to make sure people get access and being flexible. So I'm going to assume that the question really pertains to how do we be activists for improvement to all of those things. But is anybody on the panel able to speak to that question?
The question I have is, you mentioned, Nancy, concierge service for potentially for new healthcare providers coming here. I don't know if that's just in concept or being implemented, but that might be something. But I don't know where that stands, but that sounds very interesting.
Yeah, so we are in the process of developing a strategic plan right now that we'll be presenting to a larger group of employers, mostly healthcare professionals, but also Cal Poly, CR, County, City of Eureka, Coast Guard, and a number of others who are involved in this. So we'll be presenting that later this month. And from there, once we have the resources in place, we will be able to start taking action on it and start building out the program. Hopefully before the end of this year, we'll at least be building, and early next year have something in place. And does that answer your question? I can give you more information too, but
that might be a way for networking for people, being even on a list. Like, hey, if someone comes in the area and is interested, they have questions about some, so if you have a list of people who can answer questions or meet people for coffee.
Yeah, absolutely. That's going to take a lot of coordination, but we want to do a really excellent job of supporting folks and working in partnership with a lot of different groups that are doing some of the things that are being talked about today, such as employment for trailing spouses. I don't like that term, but, the spouse of the doctor or professor or whoever's coming in. There are people who are doing that. We don't have to do that. We can point them in the direction of where they can go. But so it's going to be complex if we're going to do it right. It can't just be, let's just, tell you where to get your car fixed or, give you some information and have a quarterly happy hour. I think it's going to have to be more robust for it to be truly impactful. And if you're interested, I do have some one-pagers, kind of our concept paper available for folks.
Because they are our funders, I'm contractually obligated to mention Humboldt Area Foundation is also in the Home of Humboldt group.
Yes, they fell into, I think I might have mentioned, maybe I didn't, but yeah. But Humboldt Area Foundation is in the discussion, and they've said that they are interested in being one of our funders. So no pressure, Humboldt Area Foundation.
None at all. And just with respect to this, and I'll chime in, I'm not a panelist, but what I will say on with respect to the first question is, what are some things that the community members can do? I participated in the hiring process for a local healthcare organization. I will say that I was personally surprised by folks that we were interviewing that were coming from out of town that had a negative impression of Humboldt. Like it was crime, crime, crime. I have never been, and I've done a lot of interviews, asked about crime so much than I was with this recruitment. And so I say that to share that to the extent that you can, be a positive ambassador for our county, because we all know that this is a wonderful place to live. And so, but there is some opportunity to counter the Murder Mountain impression that you touched on there.
Yes. And similarly, one of the things that's come up in our conversations with these healthcare providers, educators, Humboldt Area Foundation, and others, is that a lot of times folks who have who are traditionally marginalized, whether it's racial, ethnic, LGBTQ, have different identities, don't always get the Humboldt nice treatment. So it's part of our responsibility as residents here to educate ourselves and to watch our behavior as we are interacting with people who may be different from ourselves. So that's something that we can all do at a local level. So that's really important.
For our office, as the County Office of Economic Development, we do seek out community involvement for certain aspects of what we do. One way we do so is through public comment periods. So when we do those analyses and those surveys, we then put it out to the public for a 30-day period where we ask for you to look at it, engage with it, and give us feedback. We do our best to comprehensively gather everything that's important to the issues that we're looking at, but we need community voice to ensure that we're not missing something through the data analysis side. Right now, we have our comprehensive economic development strategy, which is a 5-year plan for what we do within our region, what the main issues we need to tackle are, how recommendations for how to tackle those. That is currently open on our website for public comment, and I would encourage anyone in the public who would like to look through that and provide feedback to do so. The other method that for our office and the activities we do is through our boards. We have a number of boards. We have the Headwaters Fund board that helps guide lending activities, granting activities to government and nonprofits. And then we have the Workforce Development Board that guides the activities that we do in terms of what analyses we do, or as a more direct participant aspect, what industries and programs we're focusing on for our direct participant work for who we're training into the industries in need. Those are Brown Act meetings and require a public comment period. You are welcome to come and public comment, provide suggestions, speak to the board. And those boards act as advisory to the Board of Supervisors. So we do bring those items back to the Board of Supervisors for direction to work on those.
I just wanted to touch a little bit on how, like, the role of our community, right? What we can do. I know that I've heard a few people on the panel state that they have also kind of experienced the challenges of having to go outside of the county to get specific medical or behavioral needs met. And I don't know that it's so much activism, but more of like a community support. I think that being able to identify community members, if we don't have family members, that can step into a role of supporting, supporting us, supporting everyone in either transporting individuals or attending appointments with individuals that need our support, to just really build a more cohesive community, right? Because a lot of the times, we have single parents, we have adults that don't have natural supports, that are only dependent on paid providers, but those paid providers, again, are not always available. So I'm just kind of, thinking kind of like, one way that we could really make a meaningful impact is volunteering, right? Volunteering with specific agencies to be able to step in and be a care provider for a couple of hours for an individual or a family that might need extra support, so that they're not losing out on, some of that PTO, or that they can kind of just focus on what it is that they're doing and reduce some of that stress, right? And really feel supported in this community.
So there's actually another question popped up, which I can answer really fast at the bottom there. What are people doing facilitating imported healthcare? That's actually funny that came up. The county has, through our risk pool, been able to obtain a service called Jet Dental, where we actually brought some services into the county. We set up an event where employees could sign up. It was very successful. So we have access to that through our sort of JPA style. It's a risk pool, but JPA is probably a little bit easier for folks who don't live in that world. And that was actually great. It didn't provide all the services that you could get at a dentist, but they're in network with our dental provider. It's really great for folks who aren't able to get a primary. That was really successful, and we're going to see that ongoing. Certainly, if anyone has questions about it, they can reach out to me. I'm sure Jet Dental would do it even if you're not in the risk pool, but I'm sure we get a little bit better rate because we're in that. So I want to touch on that. But one of the things, or there was a few questions there that kind of touched on what's the county doing, or how do I get involved, and what's the county doing in this space? And I don't know, is Natalie here yet? I think I see Natalie up there. So hopefully I don't get in trouble with my 5 bosses. But without going too far down the rabbit hole of what is happening, because again, it's definitely not my professional expertise to talk in some of those spaces, but reach out to your board member that's in your district. I think a lot of times people probably think that they don't listen, but I can say unequivocally that they do. I sit in meetings with these folks a lot and listen to them on the dais and off the dais, whether that's in closed meetings or not. They do absolutely listen to what the public says. They are hearing you. They do take your phone calls. They do look at your emails. So that's as hard as it may seem to be like, am I really being heard? I hear it on a continual basis that they are hearing you. So when these things come up on their agenda, when you have a concern, it may not be that they're going to be able to do something about it, and they're only one person on a 5-person board, but they are going to bring it up. I hear about this continually. So I think that's one of the best ways you can be involved in this process is reach out to that board member that's in your district. You may think you're a bother, but I don't see that as the how that's received from our board members.
Did we get to the third question regarding Cal Poly? No, we're still on one. Okay, all right. Well, then let's go to number 3. So, how is Cal Poly helping to add programs for healthcare degrees for local students wanting to become healthcare providers? Professor.
So I already mentioned what I'm part of a new, is forthcoming, a Bachelor of Arts in Community Health. Right now, healthcare providers, and there's a few other programs, so I have to look back at what they are. But I know of that one that's coming. So there is an emphasis. The Cal Poly is trying to provide different avenues, both for people who want to go in the actual, nursing, or we have a nursing program now working with CR, and I'm not an expert on that. I can certainly put people in touch with folks on campus, but we are expanding our healthcare offerings, classes and degrees, certificates as well. There's a bunch of them, and I just don't have them right now.
No problem at all. Peggy, jump in here.
One of the programs I can speak to, we currently have a healthcare program running through the Workforce Development Board. We have 70 individuals enrolled in that for RN and LVN training. Part of those individuals are using the partnership between CR and Cal Poly for the Bridge program. So we initially send them through CR's program, pay for their training, all of their needs around that, help them then apply and get in through that Bridge program to make sure they're moving on for higher education. And that Bridge program, I think, is a really great, relatively new aspect of how the healthcare pipeline is growing in Humboldt County for education purposes.
Thank you, Peggy. And Zach, you mentioned Jed Dental, and actually, I forgot to say for the group that earlier on we might throw out some potential solutions to some of these problems throughout this discussion. But the primary aim of this event really is just not to provide solutions. I think that we'll get there later in the series, but we feel like we wanted to sort of expand the problem, because when you talk about healthcare, there's sort of this tendency to really look at it through physicians, and whereas that is a critically important component, there are also a lot of tentacles to this problem. One of them that we talked about, though, we talked about the economics of it and traveling out of town and the economic burden. And Zach, you just touched on dental and some of the stuff that we're doing at the county with Jed Dental. I'm going to get myself in some hot water here, and I got a dentist appointment next week, so it's going to be fun. But one of the things that really bothers me is when you go to the dentist now, or at least me, I have to pay for the service up front, and then insurance reimburses me. And that can be an economic burden for folks. And I just think if you got to pay for your dental stuff in advance, and then you may have to travel out of town for healthcare. Peggy kindly touched on, the living wage. I mean, it's this sort of perfect storm potentially of negative events. And I don't know what the answer is, but I wanted to acknowledge that that's a very real reality for a significant portion of our population. So.
Yeah, absolutely. That's something that we have experienced, and I'm sure other employers have experienced, particularly with the specific insurance carrier, who shall not be named, that we don't use anymore, that was not really working very well from our perspective with our local dentists, and it was becoming pretty tumultuous. So we actually took another effort forward. I give our risk manager, Amanda Phillips, a lot of credit for that. She worked with our risk pool to have them look into finding a different insurance provider. We now use a provider called Emeritus. They do all sorts of different insurance, but they've been actually able to work with our dentists to assist in remedying a lot of that. So I'll have to talk to you, Jeremy. We've got to get you a different dentist's office who will bill for you. But they were even willing to, because that was one of our main issues, was our dental providers are so impacted, they don't really have to bend over backwards. I keep using that term. To get people to come in. They're like, I don't really want to deal with insurance. You send the claim in, whatever, right? And they know if they do that, there's still someone coming in behind them because they're booked up. But we were able to work, kind of boots on the ground with this new insurance provider and really touching base with our dentist's office. And there still are some out there that are kind of unwilling to take that step of doing the billing and not taking that upfront cost. But that was something that, for the longest time, was really deterring people, even if they had a dentist, to seek out those services, because they could not put that money out of pocket, especially for things that are, costly, root canal, something like that. So that has significantly increased. They were even willing to not take that upfront cost for out of network. This insurance provider emeritus is like, we will do it even for out of network providers. And in that, working with that insurance provider, they were able to actually get some more people to come in network. So that was a huge shift that I think, looking at what are your insurance programs. We're a CalPERS employer, so we do CalPERS Health. They provide actually, from my perspective, pretty great insurance options. That's not really the issue. It's more of the access in that realm. But in this space, we realize, maybe there's something that we could do about the provider that we have, and that has significantly increased usage and success rates with people. And then on top of that, Jet Dental is one of those services that is an in-network provider, so it actually works out perfect. Yes, the person still has to pay. It's not, the county doesn't just pay for you to go to this dental provider that shows up, but at least when you go, you're going to be getting the best rate because they are an in-network provider, and you can drive down to the street. We usually run it at like the Vets Hall in Eureka, so it's really centrally located for employees.
Awesome. Thank you. We are not going to have the time to touch on this, but I just wanted to say that, Marlene said something that really resonated with me earlier, which was when she had mentioned, I believe it was teachers and the additional stress that is sort of like placed on them and with relative to like providing behavioral support, and then just me in my world, in the world of sort of like organizational development, when I look at that and you look at, say, like Gen Z, where anxiety and depression are sort of like very prevalent in these generations. And for us as employers, it's really critical for us to find ways to support them in these expanded needs, because the better that we support our employees, the more engaged they are, the more productive they are. And so that whole chain of events. And so just briefly, Marlene, if you have anything to add, like what are some consequences of unmet behavioral health needs, or if you're not getting the support that you need?
Well, I mean, what we see as as a START model, we do a lot of preventative and intervention to really decrease crises that may occur and really encourage individuals and systems to live a well-balanced life through the development of positive relationships, really meaningful engagement, and everyone kind of really identifying meaning and purpose within their life. And so some of the impacts that we are seeing, right, is that people have a lower window of tolerance, meaning that they don't have the capacity to really kind of stop and reflect and listen and pay attention to what the person might be going through. What's happening is that because of the stress, a lot of people tend to react more than, to remain calm and really assess what it is that the person needs at that particular moment in time. And what then happens is that it just creates a very dysfunctional and chaotic environment for everyone that's kind of in that situation, whether it be at someone's home, whether it be at school, whether it be at a grocery store. And so, again, a lot of the work that we're doing is to increase the capacity within the community to understand everyone's vulnerabilities, because we all have a different level of stress response, right? We all need different things to help us kind of calm down and cool down and really be validated in what we are experiencing. And so, we can't read people's minds. We don't know what might be triggering them. And so really leading with compassion and empathy, and, putting yourself in people's shoes before, we are quick to assume that they're having a behavior or an outburst, because at the end of the day, like I mentioned at the beginning, behavior is communication. And when people are in a very high level of stress, right? Cortisol is sparking, their, body is shaking. There's no way to really communicate what's happening. Things can spiral pretty quickly. And with that said, sometimes there's law enforcement involvement, there's hospital utilization. And so through one of our roles as START, we really, again, connect with those hospitals and clinics to really ensure that that when a participant, or just in general, anyone with mental health needs is going in for support, that they recognize just some important things, right? How to be able to identify that a person might be just experiencing a mental health crisis, and what things they can do, whether that be providing a couple of fidget toys, providing water, reassuring that they are in a safe space, and that, you know, this is a judgment-free zone. One of our efforts has been in creating what we call calm kits. We got some of this information from Laura, I believe, Montoya. She works with the Eureka Police Department. And so we developed calm kits, you know, just little tote bags with a bunch of different fidgets, toys, whiteboards, index cards, markers, just a lot of different trinkets to be able to support a person that might be experiencing just a really high level of stress. And maybe, again, as a service provider, that's maybe for you know, a first time meeting them, some of these calm kits could really come in hand to just really ease some of that anxiety, build some rapport, and allow a space to kind of just ease out of that.
Thank you. Really appreciate that. Katherine, we take one more.
Thank you, Marlene, for speaking on. Well, one thing I realize that the panel might not have expertise on, but something that I think is important in this conversation is the presence of preventative care and wellness, and talking about the outcomes of not having access, you know, the impact to our economy and the stress levels that people in our community feel, and how that impacts people not only wanting to stay in our community, but to join our community. I think that's incredibly important. And we are running a little bit short on time. So I wanted to ask one of the audience questions and speak to this obviously to the degree that you can. But a question is, who is collecting and sharing robust data about healthcare needs and impacts in Humboldt? And anecdotes are important, but where's the compiled information? And I know for my colleagues and I, when we were preparing for this event, we did struggle to find some data. There are some really great studies that we pulled information from, and I think some of you have mentioned, but can you speak to any additional data that maybe we haven't spoken to yet?
I can speak to the need for more data for sure. So the Redwood Region RISE initiative, which was through California Center for Rural Policy, North Edge, and a huge amount of community input, catalyzed a lot of the information that we have today. It combined information from a 4-county region, so from Lake, Mendo, Humboldt, and Del Norte, and did focus part of its efforts on the healthcare data piece. And so there is availability to that data through their website. They do link to all of the studies that they utilized for that information. About 2 years ago, the Humboldt County Workforce Development Board was one of the funding partners for the behavioral health care study that was done locally. That was a needs and gaps analysis that showed us exactly what positions were needed for what needs needed to be met, and what the 10-year growth looked like, and what the needs for positions were for that. We just did our local and regional workforce plans, and as I mentioned, we opened them to public comment. And one of the really great public comments we got was that the behavioral health care study was incredibly useful to catalyze workforce programs and business development programs in behavioral health care. We need it in healthcare and dental as well. And so that will be coming to the Workforce Development Board to potentially fund that initiative to get that similar needs and gaps analysis done for healthcare and dental as well.
I'll just echo that at the university, California Center for Rural Policy has a lot of reports, and you can go to their webpage. So CCRP, California Center for Rural Policy.
Certainly not my area of expertise, but we were actually approached by our Department of Health and Human Services director prior to this, and to ensure that, you know, some of the conversation was driven by some of the work they've been doing in public health. I know the acronyms are CHIP and CHOW. I would look to Dr. Clark or Catherine to
Chip and Chaw.
CHIP and CHOW. There you go.
Health needs
CHOW. There's a
health
CHOW as a type of position in public health. But public health, they're collecting this data. They're the experts in that field. They've written reports on this. I think definitely there's opportunity for more information to be collected, but that's definitely a really good place to start under the public health branch of our Department of Health and Human Services.
Thank you, Zach. Wow. 2 hours is just not enough time. It flies by. I feel like I do another 2 hours easily. Professor, I wanted to circle back to you because you were interested in some per capita information. I don't have that, but a physician colleague and a friend of mine, Dr. Bruce Kessler, gave a talk at the Humboldt Senior Resource Center. And in that talk, there's a slide where Dr. Kessler discussed access to medical care. And primary care for physicians per 100,000 population in 2024. Humboldt was 50, California was 75, and in the U.S. it was 70. So you can extrapolate from that and run the calculations to get to the per cap number. And I'll send this your way just so you have it. I have Dr. Kessler's permission to use what I need, but I did just want to circle back on that. So, yeah. Any final questions? All right. Well, then I really want to thank our panelists. Thank you very much. I personally know that you are all very busy, and we really appreciate you making time to engage in this process. I think that the community is better for it. The audience is better for it. And just thank you so much. We really appreciate it. Katherine.
And I'll just add, we did have another question that came up that asked something that I wanted to share with the group if we haven't stated it clearly already. How can we increase health literacy and knowledge and preventative care in the general population? Well, I might not have the answer to that. Part of the purpose of this event is to connect experts to our community, to share information. The County of Humboldt Human Resources is an avenue that you can reach out to if you don't have contact information for others, and we'll work, especially our ODE unit will work to connect you to information and ways that you can be a part of solutions in trying to address these issues.
Yes, sir.
Just one last thing. I believe we're going to have this information available as like a recording. So for all of you out there, definitely share this broadly. I know there's a lot of other stuff going on today, and so really appreciate everyone that came today and those that are online. But definitely sharing this information so people can see that this conversation's happening would be great.
Thank you, Zach. And actually, just in the last couple minutes, any final words? I want to make sure that from the panelists that you have the opportunity to leave the group, the audience, with anything you want to leave them with. Promote anything, communicate anything, share any thoughts, let them know any work you're working on.
I just want to reiterate, I'm here to represent the business community. The business community needs to thrive for our community to thrive, and access to adequate health care is a huge concern to the business community, as we've shared. It's tied up in so many other issues, and we really have to partner and work together to find those solutions. We need to stop digging in our heels or making things more complicated than they need to be to overcome these issues, because as I can't remember if it was Bruce or Zach said, our population is declining, our economy is declining, and if we want to overcome the challenges that we have as a community, we have to work together and not be territorial, just kind of break down the barriers. And it sounds idealistic, but I've seen it happen in this community. I think it's a beautiful thing, but we need more of it.
I love that you said not to be territorial, Nancy, because I did an interview on K-Mud the other day, and I shared that same sentiment that, like, in my view, in order to solve this, I think that folks need to understand, A, this is everyone's problem if you live and breathe and interact with the medical system in Humboldt. And then B, someone else wanting to do some work on this topic that doesn't diminish any work that anyone else is doing. And so it means a lot to have that come from you. So thank you very much, Nancy.
on the workforce side, I would just encourage that if you know of individuals who are interested in entering into the healthcare industry, our job center does continually do these programs where we do pay for the training as well as the supportive services needed for individuals to be successful in the healthcare field. Our services include paying for their training, their books, their equipment, potentially gas cards, bus passes, whatever the need may be. But it also includes vocational counseling, soft skills training, and then after completing training, a period where we do help them find their employment, and then we follow them for 2 years after to make sure that they're successful in that employment. And so I would encourage that if you know people interested in entering the healthcare industry, you send them our way.
Through our START program, we do offer monthly trainings led by Dr. Wendy White. And at times, again, because we have individuals that might be experiencing a very complicated medical biological challenges, whether that be, tumors, on top of other things. But we do focus a lot on the trainings on IDD population, so intellectual and developmental disabilities. But at times we do offer some information regarding the medical aspects and their biology and how it's impacting them, and things that we kind of need to do to kind of brainstorm to really support the individual or any just general individuals that might be experiencing similar things. Our next one is going to be held this month, but the third Thursdays at 3 p.m. And it's going to be touching on grief and loss specifically, not so much on the medical component, but that's one avenue in which we can kind of provide information and education regarding some health factors.
Awesome. Well, thank you all. May I request a round of applause for our panelists, please? Thank you very much for your time. Oh, we do hope that you will stay and join us for lunch. I think that has arrived. And okay.
Yeah, the magic of theater. We have veggie sandwiches, chicken sandwiches, ham. We have a side of pasta salad, fruit salad, chips, water, and CCRP came up a lot in the Q&A, and we're going to have the executive director join us for panel 2. So if you're interested, stay for panel 2, please.